Every year, the NHS deals with 45 million outpatient appointments and carries out more than 650 million diagnostic tests. Many patients have to go to the hospital for appointments and tests, but with advances in modern medicine and technology, this is no longer necessary. Up to 80% of appointments could be carried out in the community outside of a hospital setting. We visited Colchester to hear about a nurse-led service which brings prostate diagnosis and treatment closer to home.
What we provide is a prostate assessment clinic. Men are referred by their GPs. They come along to see us for tests that the GPs can't generally do in their surgeries.
Instead of them having to go into hospitals, we can provide a specialist service in primary care. And to do this, we decided to introduce a nurse-led service capable of screening a large number of patients. Patients are processed through a service safely and much more quickly than before.
We find that nurses can do the same sort of assessments that used to be done by doctors because we run to a protocol, and things that come outside that guideline, then we do refer to the doctors. That's where the consultants act as our backup. I think we found you didn't empty your bladder very well, but now that's much better. So everything's going very well, very satisfactory. There's a chance to be challenged, there's a chance to do a bit more learning. I've been off to do a urology course. I don't think I can think of a patient who's been unhappy being seen by a nurse rather than the doctor. Yeah, very satisfying.
The consultant really starts to see and have time to see those patients that really need a surgical input rather than medical treatment. The main challenge in this was the logistics of training up nurses, getting the GPs familiar with what we wanted to investigate. But once we'd done that, we found that the service was very well accepted by GPs and, more to the point, very well accepted by patients.
I think it's cost effective, and yeah, closer to home seems to me to be a very good idea that patients really like. It feels ordinary to them. It doesn't feel like disease, ill health. It feels like a bit of inconvenience. We'll get it sorted.
Patients tell us they want healthcare to be more accessible and more convenient. Let's have a look at a health centre in Sunderland which has managed to achieve that.
Welcome to Bunny Hill Primary Care Centre here in Sunderland. A wonderful building. Let's go and have a look around. The furthest corridor to my left is planned care, where we deliver outpatient services. Then we've got a minor injuries unit, and then finally to my right here, a general practice, and we can go and have a chat with one of my colleagues, Dr. Alan Jones. Alan, good to see you. What do you think are the main advantages both for you and for your patients?
Well, it's a much nicer environment for them to be in. There's some ability to do tests here that used to be done in hospital, like, for example, X-rays, and there is the space and potential to expand that.
This is the planned care area, where we've got a number of consulting rooms and other facilities that are broadly similar to those that we would have in a traditional hospital outpatient clinic. Let's go in and have a word with one of my patients now. How have you found the care that you've got here?
Fabulous.
What about the building itself as well?
Very clean, tidy, everything's to hand. You come for your appointment, you see your consultant.
You'd not be very keen if I said, let's look after you in the hospital clinic?
No, I wouldn't go back again. I love it here and that's it.
I think one of the problems we've had in the past is there's been a split between primary and secondary care, and it's important, if we're going to look after patients well, that we get over that split. And here we're delivering an integrated service where patients are seen in the hospital if they need to be seen in the hospital, but wherever possible they're seen in a centre like this, closer to home, more convenient for them. We also have a wellness centre here where people can have exercise and where there's a well-equipped modern gym.
We get referrals from GPs and all other health professionals, and then people come to us for exercise. We get people who have had heart problems, breathing and respiratory problems, diabetes, and they all seem to benefit from the exercise.
Having a pharmacy here in the primary care centre has been a major advantage. Patients can come and get advice from the pharmacist and their staff, and also I've got the facility to have drugs here for me to prescribe. The building here isn't just a primary care centre, it's a joint facility with Sunderland City Council, and amongst their facilities is this wonderful library with, included in it, an internet cafe. And we've also got a cafe here with snacks, drinks, full meals for anybody to use whilst they're in the building. Cheers. I hope you've enjoyed seeing something of what we're doing here at Bunny Hill Primary Care Centre. Goodbye and thank you.
Minor operations do not always have to be performed in theatres in large hospitals. The Tiverton Community Hospital specialises in performing minor operations to help relieve the pressure.
This is the day case unit, which is on the first floor of Tiverton Community Hospital, and we're presently in the anaesthetic room prior to the afternoon list, which I'm doing with one of my colleagues, a GP surgeon. The sort of operations we're doing are varicose veins, hernias, carpal tunnels and that sort of thing. I'm a local GP, but I do 3 lists of anaesthetics a week. 5 GPs work and have roles within this unit. 20 consultants will come and deliver specialist surgical care. There are then all the nurses and support staff to keep that unit going.
This is a man who's had a hernia repair done about 5 years ago, and he's got a recurrence. What we do is to just free it up, and then we can push it back, and then we put a mesh of nylon just in there.
The patients can be seen, treated, discharged from this sort of environment very easily, and that frees up a big district general hospital.
If we didn't do our operating here, he'd be going down to Exeter to do this. I think Exeter are struggling to do all the work that they have anyway, and so they're trying to get more work out in the community. And in fact, we have lots of consultants from Exeter come out here into this theatre. We do operation, get a lot of support from them. Well, I keep updating my surgical skills, I operate with them, and I can discuss cases with them.
The fact that we are a specialist day case service means that the patients who are booked in know they're booked in, know they're going to get their operation on that day. Many of the patients are local, they know the hospital, they know the people working here, they feel comfortable in this environment. The consultants move to the patients rather than the other way around. And if there are any problems, we, the GPs, end up following up those patients. So it is a continuum of care that the patients appreciate.